I'm very, very grateful to be invited tonight, and I hope that what I can share is of use. I was thinking about, I think it's George Bernard Shaw, a man can no more have an original idea than a tree can grow in the air. So I'm really going to share with you I thought, some of the things that have been on my mind, and what I've been reading lately are Bernard Lowndes' essays. I don't know if people are familiar with the great cardiologist, Dr. Lowndes, but he has put on his personal blog some essays about caregiving that are profound. Arthur Kleinman has published recently, he's had a series of essays about caregiving in The Lancet, but there have been two particular essays, one in The Lancet and another in the New England Journal, about caregiving as a moral endeavor that have been very, very powerful. My job is a very compelling job right now, my main job in the hospital. Our hospital is about, I think it's officially 200 beds, so that's a small hospital. There are 3 mental health units, which I think is a great pride of the hospital. There's a chemical abuse unit, there's a traditional inpatient psych unit, there's a geriatric psychiatric unit, which really is sensitivity to the needs of the community. And then there's the critical care unit, the emergency room, the maternity unit, and even a few pediatric beds. So it's a really it's kind of special place. And the experiences there, I had been out of the hospital for about 5 years working at a state psychiatric institution. And those patients are a very confined population, indigent to be sure. But going back into the hospital where you see a slice of life and you see this rush of amazing breadth of patients for the last year, the thing that's astounded me is that the poor have gotten so poor. When I was young, I'd rather be introduced by saying, this is Andy who used to work for a living. Because I went to medical school late in life, and I spent several years working in factory jobs, for example, as a carpenter in a kitchen. And those jobs that I had then that might pay 7 something an hour, 8 something an hour, those jobs still pay 7 something an hour, 8 something an hour, and people are raising their families on those jobs these days, and it's astounding for me to think. And then, we have this incredible privilege, and it's every day. Since medical school, I really don't need an alarm clock. I wake up, I'm very excited to try to make a difference for my patients. I'm trying to make a difference for my colleagues, to partner with the nurses to do the best we can do. And so I have this amazing chance in life to help try to make the world a better place. And we're smacked in the face all the time by this outrageous, unnecessary injustice that I just don't even know how to get over. So what's been on my mind in terms of PNHP, the question that we've been through a very difficult time. The President of the United States tackled healthcare reform. He said famously that healthcare reform cannot wait, it must not wait, it will not wait another year. And then he enacted a reform that rolls out over nearly a decade, kicking the can way, way, way down the road. When our society has all of the resources it would take to take care of absolutely everybody that lives in this country. And so we have a time when we could see what is possible, and yet it seems impossible. So are we going to really get there? And I think that's what's been on our minds a lot. And the more I think about that, the more I think that we really need to discover the courage of our convictions and just keep doing what we've been doing. Physicians for a National Health Program is essential. It's essential that we be physicians. We have a physicians organization. It's essential that we recognize the very special role that physicians and surgeons play in society, and that the profession is a real profession and has its real obligations to society and to itself to fulfill a moral calling. And that moral calling has actually evolved over the recent century. Once upon a time, it was all about our ability to do good because we couldn't really help the patients, right? We just really do what we could to sympathize with the suffering and the inevitable death. And more, it's a profession that embraces science as a way to intervene in ways that are actually measurable and proven. And so in order to think about our place as a profession, we need physicians to say, this is how the system should be. In medical school, we teach the students really that it's all about your patient, and you can't go farther than that. I have a man, we have a man on our service who's a Vietnam veteran with PTSD, and the social workers were telling me that he's quote unquote burned all of his bridges. There's absolutely nothing we can do to help his social circumstance. He's on the cusp of homelessness, and that's where he's going to be. We can't do anything about that. When his breathing gets bad, he'll come back to us, and that might happen every other week or every other day even. And you can think about his breathing, but we can't do anything about his. And in medical school, we sometimes teach the students that that's your proper place. Just pay attention to his breathing. Never mind that other stuff. And we see the social histories from some of our colleagues where the social history is that the patient smokes or doesn't smoke. That's the entire social history. Nothing to do with the fact that he's a Vietnam veteran with PTSD who is having a specific time of year problem with what's happening in his life. We don't do that, and yet we long to do that. And so what's been on my mind is that we need to claim our proper place in society. And part of doing that is advocating for a national health program, nothing less than something that will provide comprehensive care to absolutely everyone. And we need to claim the place that we all want for our society, which is to be clinicians who are interested in our own outcomes, to be teachers, not necessarily teachers of medical students, teachers of our patients, teachers of our communities, right? And to be researchers in the sense of what's happening in our lives, what's happening in our patients' lives. It can also be clinical research, it can be bench research, but to really have the grown-up place in our profession. So to that end, what I talked to the PNHP board about this year was maybe we need to develop a sign-on statement along those lines, something that says caregiving is essential in our society. It's what gives our lives meaning and value as physicians. Our profession has so much to offer. And these are the ways that profit-seeking thwarts and poisons our relationships. And today, the things that happen in the United States of America are really unbelievable. Medical deportations. Hundreds of patients. You saw the famous one in the New York Times. The man was a migrant worker in Florida. Someone else had gotten very drunk and stolen a pickup truck. And the drunk driver and the pickup truck hit the migrant workers head on. They were on their way home from work. And the man had a traumatic brain injury, intractable seizures, got put in a Florida hospital. They figured out what village he was from in Guatemala. The hospital hired an air ambulance and dumped him in Guatemala City. And the New York Times visited him in his remote village where he had seizures every day because he had no medications. And his mother did the best she could to care for him. The Los Angeles Times had a similar story. The Des Moines Register, a similar story. And so this has become this is an extra-legal deportation. This is a private deportation. It's absolutely heinous. And to think that we live in a society where that could even happen, that we have the American Medical Association Ethics Committee said that physicians have a responsibility to stop these from happening. That's our responsibility according to the American Medical Association. Everyday injustice that we live with is much more mundane in the hospital where I am, but just as bad. An elderly patient who has a managed Medicare plan. So this is someone who has worked their whole life in a factory, retired, has Medicare. Because of Medicare Part D, they end up enrolling in one of the managed Medicare plans. They have a stroke, they're to go to rehab, and they're told that your acute rehabilitation copay is over $300 per day. The patient has no resources that will go beyond a couple of days of rehab. It's not a proposal that makes any sense for the patients. And yet, that's their Medicare benefit because of the privatization. The majority of hospice care in this country is now for-profit. For-profit hospice care. To think that the end of someone's life, but with the philosophy of making the most of every day that that person has alive, to try to make their day the best day it can be as a chance for someone to extract a profit, is outrageous. And we have to do something about that. I can go on. I'm sure that you have your own catalog of these kinds of injustices. But so these are the things that have been on my mind about how to advance our cause and articulate what's happening. We have to sort of claim our proper place, our proper relationship to our patients and our society. And yet the irony is for me that I really love my job. I wake up, I'm excited to go to work. It's very, very frustrating. There are a lot of things that don't work. There are a lot of things that are broken. There are incredible amounts of unnecessary care and treatment, and yet we want to be in there and we want to be doing it. And the nurse colleagues that I have are people that I think of as heroes. You know, one of our ICU nurses retired, and all I could think was what a wonderful thing she had done with her life and all the lives that she had touched. She, not just the patients who she had done the bodily care for or their families that she had consoled, but lots of people that she will never meet for those patients later and how they face those crises. So just to be part of that is incredible privilege, and I think we should be articulating exactly those things.